She's completed the acute treatment of the illness where they had to help her breathe and manage other aspects of her medically. And now she is not as involved medically, and we can spend more time focusing on our rehabilitation efforts. Well, she's seeing many different rehabilitation specialists right now: physical therapy, occupational, recreational, speech therapy, nursing is involved as well. And we're all working on different aspects of her neurologic recovery, but then working as a team to make that recovery as full as it can be. Savanah is making progress. It's slow, steady progress, but it is progress. She's still pretty limited. She cannot say any words. She cannot move her arms or legs very well, but she is starting to follow some commands, and that's very encouraging. Well, because we've seen some progress, even though it's small since she's been here, we certainly expect her to continue to make progress in all areas. We don't know how much recovery, how fast, but we certainly expect her to continue to improve. Yeah, this has to be very frightening for Savanah to be in this state, because I believe she is pretty aware of the state that she's in, and it has to be very comforting to have her parents there by her bedside. So it's hard to tell when she's minimally responsive what is going on in her brain, how much she understands of what's going on, but it seems like she does have some understanding of who's in the room and perhaps of the conversation as well. So some of the clues that we look at for neurologic recovery are consistent movements in a certain way. So a big one is eye movement. If she can follow someone with her eyes, that's a very good sign, and that's a sign of recovery and awareness. But a really big sign is the ability to follow a direction. And we finally hit that milestone where she can consistently follow a simple direction. Sometimes it's a few second delay, but she can follow a direction to, say, move either one of her arms, and that's huge. So the ability to follow a command is very huge. It takes a lot of connections to follow a command. You have to hear the message, you have to process it, you have to decide that you're going to follow that command, and then your brain has to be able to make those muscles move to follow that direction. So the following directions is a very good sign of recovery, that a good sign that a lot of the brain is working. You know, no child, no family expects this to happen, and it comes out of the blue, and you know, it can be very devastating. Savanah's parents have been very supportive and very realistic, and that's helped the whole team, and it's helped Savanah. So fortunately for Savanah, because of her age, we generally see younger brains recover better after an injury, a virus, a stroke. So we're more optimistic with her than we may be if she was much older.